traded in over time. So we start with a pill before they get to the office, and then we have intervals that we actually put more pill, we add a pill on. So it may be every 30, 45 minutes that I may add a pill.
And the expert would know what needs to be given to that patient. Yeah. And are patients different?
Sure they are. Some patients you can sedate in 1 or 2 pills. Some take 5.
And how do you know that they need more medication?
Well, we're looking at certain parameters in the operatory. We're looking for respiration and pulse oximetry that we have. We have a device that we have hooked to the patient, but there's certain, I want them sound and asleep before I initiate any dental procedure. Right. We want them to have a great response and a great outcome. So
they're closely monitored.
Closely monitored. That's one of the keys. I think having a dentist that does this, that doesn't monitor patients, is real dangerous. It has to be a monitored situation.
Do you put a cuff on them to check their blood pressure and all the other vitals?
We have a pulse oximeter machine, and we have a blood pressure cuff on them, and we also have a PSO2 sensor on their finger, which reads the oxygen saturation in their blood. So there's alarms that go off if they're falling below certain points that we don't want them to be at. So it's very, very safe if done in that fashion.
All right. Let's go to the next slide if we can. I find this fascinating. All right. So we're talking about the pill, and it is smaller than an M&M.
Yeah, just a tiny. It's just a neat way to compare how tiny the pill is. It's a very, very small pill, easy to swallow. Yeah. There's an ibuprofen on the far right that shows the difference. So.
All right. Next slide. Key points.
Yes. Respiratory depression, that's probably the biggest thing that you have to deal with triazolam. And any of these hypnotic drugs, they will cause you to decrease your respiration rate. So that's one of the big things we monitor. And if their pulse ox is too low, then they're not getting enough oxygen.
What is
in
a pulse ox?
It's the machine. You see it in the picture there.
Where?
It's the small machine in the back. There's actually another picture down the line in the
Oh, okay. I think we are going to see that, but it would be at 9 o'clock, ladies and gentlemen, on your clock if you were looking at this from right to left. And that looks like you. That would be you?
That would be me.
Now, is this the patient? Is the patient fully knocked out at this point?
They're totally asleep. They're covered up with a blanket. It's cold in that operatory, and they're sound asleep during the procedure.
So they are sound asleep?
Right.
They have no idea what's going on?
They can respond to me.
They can.
But they don't remember what they're saying.
Oh, okay. I had a colonoscopy. Is it similar?
Well, they're using IV drugs, but it's similar in that you're out of it.
Yes.
But you can't respond during a colonoscopy unless they're doing a different.
No,
I've had one too, and you're out.
You're out.
Yeah.
Yeah.
It's different. That's different.
But I thought I knew
sedation.
what was going on. I felt like but you don't know what's going on. Okay. No. That's interesting. Okay. Well, then I think I can understand what you're talking about here then. So, like, if I'm laying there and I feel like I need to, like, let you know I need to spit or the suction, how do I communicate that?
Well, we're taking care of all that.
You are? So I don't need to worry about being strangled?
No, not at all. I think the biggest thing that we try to do when we sedate patients is we want to make sure that they're comfortable, we want to make sure that they're safe, and we want to make sure that they can respond to us at all times. Like if I shake you and say, Joey, do you hear me? You can hear me, but you're out in left field. You don't know what's going on other than that you can respond. And that's for safety reasons, too. I don't want anybody sedated to a point where they can't respond to me. That's not safe.
Okay. And so this sensation just lasts about an hour?
Well, no. I mean, it depends how long the procedure is. And it depends on what we're doing. I mean, if we're going to be sedated for 3 or 4 or 5 hours, I mean, we sedate patients for a long time. So.
And what type of procedures are people coming in to have to be sedated?
That's a good question. I think probably the big advantage to being involved in sedation dentistry for a patient's perspective is that they are allowed to get a lot of dentistry done at one time. So if they're one of these 20–25% of the population that has avoided the dentist, and they have an opportunity to get dentistry done all at one time, then they're doing more dentistry and getting a bigger chunk of their problems fixed at one time because you're out of work for that day. You can't go back to work that day. It's not something you can jump in your car and head off to work.
But I can sleep it off that night and feel like I'm ready to tackle the next day?
Usually that's one of the really unique features of the drug. If you drink a lot of water afterwards, it passes through your system, and as I said earlier, there's no active metabolite. So once it's passed, it's a single-pass drug. Once it's passed, you're back to normal. By that evening, you're fine. It's unlike Valium. You're kind of groggy for a couple of days. So it's a different drug in that respect.
Okay, I know we have more slides, but the phone bank's beginning to fill up. So let's stop right here and take a caller, shall we? Here in Charlotte, I think we have Larry. Is that true?
Yes, this is Larry.
Hi, Larry. What's your question for Dr. Ed Porter?
Well, first, I'd like to tell Dr. Porter I'm a huge fan of your work. Gosh, Dr. Porter, big follower. But my question is, does this treatment, is it dangerous for people with high blood pressure? Because I just suffer from high blood pressure. That worries me a lot.
And are you one, Larry, that is apprehensive about going to the dentist?
No, sir, not at all. When you have a doctor like Dr. Porter who's smoking hot,
all right.
You don't want to.
You feel comfortable. But your question is, for those other viewers out there, how does high blood pressure affect someone to be a candidate? Let's hear what he has to say. And I thank you for the question, Larry. Thanks for tuning in.
Larry, thanks for calling. I think the question is a very valid one, and I think that's one of the things you want to make sure that you're looking for those risk factors, and diabetes is definitely a risk factor. High blood pressure is a risk factor, like Larry mentioned, and you got to make sure that those patients are taking their medications and that they're well monitored.
Okay, so those people are not necessarily out the window.
No.
As long as they are being regulated and they have their disease or their condition under control.
Right.
And this is all part of the screening process that you were talking about earlier.
Exactly.
Let's go through the screening process, because there may be viewers out there thinking, okay, what do you mean by a screening process? Do they come in for a consult prior to a procedure, or could it all be in the same day?
No, they do come they come in for a consult prior to the procedure, and we go over their medical history in detail and make sure that they are qualified for that type of dentistry, that type of sedation. If they have multiple risk factors, like if they have diabetes and they've had a recent heart attack and they have other system problems that are going on,
right,
they're not good candidates for this.
Okay. But if they do come in and they're a first-time patient and they go through the history, is it conceivable that they could be worked on that same day?
We don't typically do it that way.
Okay, so you would come in initially to make sure that everything's on the up and up.
Right, exactly. Yeah, and usually because the patient goes home with a pill in my office, and they take a pill 1 hour before they get to the office. They take a pill before they get there. So there's a need for them to be in the office and go through what are we going to do. Obviously you have to have a plan before you get involved in treating it. So there's a protocol that I take in my office towards that whole appointment.
All right, so it's all part of the game plan.
Right.
Once they have come for the consult, they know that they're a candidate, and then it's set up, okay, this is what we're going to do.
Right.
What is there a main procedure that people are coming in to see you for, to say, hey, look, I just have no desire to be awake for this?
Sometimes it's just that. It's just people that just don't want to be awake for a long procedure. If they're having routine general dentistry done, where we're taking out maybe a tooth or two, and we're doing some fillings and kind of a mixed bag with maybe a crown or a root canal. I mean, usually there's multiple things we're doing at once, because again, they're taking off from work. They're going to be out of work for that whole day. So
right. Okay, so you just said root canal.
Right.
Are you qualified to do a root canal? Okay. Yeah. So are you an oral surgeon where you would be able to do like an extraction?
General dentists are trained in every facet of dentistry. Endodontics, which is root canals, oral surgery, periodontics, which is gum care.
So they could come to a specialist like you and have multiple types of work done and be sedated.
Right. Well, I'm not a specialist. I'm a generalist in dentistry, so I do general dentistry all day long. But as far as having multiple procedures done, most general dentists out there can do multiple procedures, multiple types of things. Orthodontics, if they choose to.
Oh. Okay.
So it's this, specialists have had 2 or 3 extra years of training in that particular part of dentistry.
And when you say a specialist, a medical doctor?
No, like an oral surgeon.
Okay.
They've gone an extra 2 or 3, maybe 4 years longer to learn nothing but oral surgery. So they're doing more advanced procedures in oral surgery than just taking out a tooth.
Okay, I understand. All right. Let's go to the next slide if we can.